Hello everyone, and welcome back to the channel. Today, we're going to talk about a topic that affects millions of people worldwide: dementia. Many people think dementia is just one single condition, but it's actually an umbrella term for a range of progressive neurological disorders. There are many different types, and sometimes a person can even have a combination of them, which can make diagnosis tricky. So, let's explore some of the most common forms of dementia. First up is the one you've probably heard of most: Alzheimer's disease. It's the most common type, Alzheimer accounting for over 60% of all dementia cases. It often starts with subtle, short-term memory loss. Someone might forget a recent conversation or misplace their keys more often. As it progresses, the symptoms become more severe. This can include significant memory problems, confusion, getting lost in familiar places, personality changes, and difficulties with speech and language. So what's happening in the brain? In Alzheimer's, proteins start to build up in abnormal ways. You get these deposits called plaques, made of a protein called amyloid beta that form around brain cells. Inside the brain cells, another protein called tau forms tangles. This one-two-punch damages brain cells and breaks down the vital connections between them. Over time, the brain actually shrinks. Because Alzheimer's develops slowly, the early signs can be easy to miss, often mistaken for normal aging. Next, we have vascular dementia, which is the second most common type, responsible for about 17% of cases. The cause here is different. It's all about blood flow. When blood vessels in the brain are damaged, the blood supply to certain areas is reduced or even cut off. This starves brain cells of the oxygen and nutrients they need to survive, causing them to die. The symptoms depend on which part of the brain is affected, but they typically include problems with memory, thinking speed, and reasoning. It's also worth noting that it's not uncommon for people to have what's called mixed dementia, where they show signs of both Alzheimer's disease and vascular dementia. Then there's dementia with Lewy bodies, or DLB. This type accounts for about 4% of cases and has symptoms that can overlap with both Alzheimer's and Parkinson's disease. The name comes from Lewy bodies, which are tiny, abnormal deposits of a protein called alpha-synuclein that build up inside nerve cells, causing damage. Depending on where these Lewy bodies form, the symptoms can vary. If they're in the outer layers of the brain, it often leads to problems with mental abilities like attention and visual perception. People with DLB might also experience fluctuations in alertness, visual hallucinations, and movement problems similar to Parkinson's. In fact, about a third of people initially diagnosed with Parkinson's disease will eventually develop dementia. Finally, let's touch on a less common but important type: frontotemporal dementia, or FTD. It makes up about 2% of dementia cases, but it's a significant cause of dementia in people under the age of 65. With FTD, nerve cells in the frontal and temporal lobes of the brain, the areas right behind your forehead and by your temples, begin to die. These lobes are responsible for our personality, behavior, and language. So, unlike Alzheimer's, where memory loss is often the first sign, FTD often starts with noticeable changes in personality and behavior, or difficulties with language. People might become more impulsive, lose their inhibitions, or struggle to find the right words. Inside the brain, this cell death is linked to abnormal clumps of proteins, including the same tau protein we see in Alzheimer's, which can sometimes form structures known as PIC bodies. Understanding these different types is crucial because it helps with diagnosis, management, and finding the right support. If you or someone you know is experiencing any of these symptoms, it's so important to talk to a doctor. An early and accurate diagnosis can make a world of difference. Thank you so much for watching and for taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up, and do not forget to subscribe and hit that notification bell so you do not miss our future videos. Take care, and we'll see you in my next video.